All right. Good morning, everyone. My name is Joaquin Tamayo, and it's a privilege to be here this morning. I'm the co-founder of the new Middle School Kindness Challenge, the nation's first ever free online research and evidence-based effort to foster kindness in America's middle schools across the country. Before that, I was Director of Strategic Initiatives at the U.S. Department of Education during the second Obama term. And that's when I was privileged to be able to be part of the efforts to raise awareness around the country and across the federal government about the crisis of chronic absenteeism in our country, as well as the importance of the intersection of health and education to the well-being of our nation's youth. And that's why I'm here today. Got involved in this work back in 2014 with a number of folks in the room. And as a former high school teacher and principal, it was the great privilege of my life to be able to do that work at the federal level with the Obama administration. So today I get the honor of facilitating today's Ed Talks. We have 5 fantastic presenters who will deliver brief presentations that will illustrate concrete examples of some of the types of health needs and interventions that have been mentioned in remarks earlier today. So I'm going to briefly introduce our speakers for this morning's presentation, after which we'll have about 20-25 minutes of facilitated questions and answers. And so get your questions ready. We look forward to hearing them and responding. First, I'm happy to introduce Megan Collins, an assistant professor of ophthalmology at the Wilmer Eye Institute and an associate faculty member at the Johns Hopkins Berman Institute of Bioethics. Next, Kimi Sakashita, an associate director in the Alameda County Center for Healthy Schools and Communities. The city of Oakland, by the way, is a part of Alameda County. We have Jill Halterman, who's joining us by video. She's a professor of pediatrics and chief of the Division of General Pediatrics, as well as executive vice chair for the Department of Pediatrics at the University of Rochester School of Medicine and Dentistry. Next, my good friend Heidi Schumacher is a practicing pediatrician and serves as the Assistant Superintendent for Health and Wellness at the Washington, D.C. Office of the State Superintendent of Education. And finally, Jennifer Delahaye, thank you, is Medical Advisor for Health Literacy and Communication at the Arkansas Department of Health. So each of our panelists they know 7 minutes. And I'm going to be tracking that with my phone, so you'll hear chimes, very nice chimes. But when you hear the chimes, that's a cue to wrap up. And at the end of our 5 presentations, we'll then open the floor for questions. All right, so Megan, you're first.
Good morning. As Joaquin mentioned, my name is Megan Collins. I'm a pediatric ophthalmologist at Johns Hopkins University in Baltimore. Could we pull up my slides, please? I'm going to be talking about school-based vision care today with talking about an example of something we've been doing in Baltimore called Vision for Baltimore. I'd like to invite any of you who are bold enough to, for the next 7 minutes, if you're wearing glasses, to take your glasses off and tell me what that experience feels like. Go ahead to the next slide, please. For those of you who are not bold enough, or have had refractive surgery. This is what it looks like for many people when they're trying to see something either near or far away without glasses on. Recently, we've been doing focus groups with teachers across Baltimore and Chicago and asking them if they had students that they weren't wearing glasses, how they were behaving in the classroom. And they would tell us, the kids are fidgeting, they're moving in their seat, they're squinting, they're moving up to the front of the classroom, and sometimes they stop paying attention altogether. And that's the concern, is that there's definite risk of impaired academic performance for kids who can't see. The sad reality, though, is there's lots of kids out there who need glasses that don't have them. I was part of the Baltimore Reading and Eye Disease Study, which was a program done in Baltimore from 2014 to 2016 to look at kids in the city who needed glasses and what we could do to help them access care. We went into 12 schools, examined 320 students, and gave classes to those who needed them. The shocking thing that we found, these are second and third grade students, And of a third of students who had reported having glasses in the past, only 6% still had them when we went in. And this is 7 and 8-year-old kids. Now, how do kids usually get detected as having vision problems? Most states mandate vision screenings. For the state of Maryland, we do this at the grade of first entry, first grade, and 8th grade. Other states mandate differently. The importance of those vision screenings is that's really the first time that many kids are picked up as having a vision problem. In fact, 75% of kids age 13 or less, they don't know that they have a vision problem. They may be walking up to the front of the board because they think that's the normal thing to do. So vision screenings become incredibly important. But the traditional paradigm is that when kids fail a vision screening, they get a letter that goes home. And the letter tells the parents, find an eye doctor in your community, go to that appointment, wait several hours while your child gets their eyes dilated, and then if they need glasses, go find somewhere else to get the glasses. And inevitably, most of them will break those glasses, go back again, get a new pair of glasses. And of course, make sure they bring them to school, wear them at school, bring them home, and don't let the dog chew them. So there's lots of challenges from every step of the way. And what we figured out is, particularly in high poverty communities, people just aren't accessing care. There's data that suggests in high poverty communities, as few as 5% of kids who fail a vision screen are actually getting care in the community. Some work done out of Wills High Hospital asking parents about kids why they weren't getting vision screening, it ranged from everything. Lack of communication, meaning the information didn't get home, they didn't understand the information that came home, it was in a language they didn't understand, they didn't understand the significance, particularly the significance for learning, or they had other things that were competing demands for what they could do. The good news, and we can move to the next slide, please, since you're probably all getting a headache there. The good news is we have a solution. This isn't rocket science. We know that kids who have vision problems, for the most part, have refractive error. They need glasses. They're nearsighted, they're farsighted, they have astigmatism. And if you simply give them a pair of glasses, they can see more clearly. What's the challenge, though? The challenge is that many of the kids are not getting them through the traditional paradigm. This has called many places to think about what's another way to get children to access eye care. And one of the things we've been doing in the city of Baltimore, and you can move to the next slide, is what's called Vision for Baltimore. Vision for Baltimore is an initiative that started 2 years ago. It's a collaboration between the Baltimore City Health Department, and I have one of my health department colleagues here today, as well as Johns Hopkins University, the Baltimore City Public School System, Vision to Learn, and Warby Parker. And the goal of this program is to bring vision care, every single aspect, into the school. So if we go to the next slide. There's multiple tiers to this process. The first is doing vision screenings. These are done by the health department. They're done actually for every single child in the school system. The initial program is a 3-year program. There's about 150 schools within Baltimore City, so about 50 schools are served per year, and every single child in that school gets a vision screening assessment. For children who fail the vision screening assessment, they get a form that goes home to parents telling them that now they don't need to go find an eye doctor in the community. They can have their eye exam done at school. So there's a mobile clinic that comes to school, and I'm somewhat envious because the amount of great equipment they have in that mobile van is anything any eye doctor would want in their own office. But the kids go from the school building into the mobile clinic and they have their eye exam. The eye exams are performed by licensed optometrists, and any kids who are found to need glasses are prescribed glasses. And they're not only prescribed glasses, they're actually able to pick out their glasses right there. And fortunately, we've had the generous support of Warby Parker with a great selection of frames that are attractive and kids like, and they get to pick their own glasses. About 2 to 4 weeks later, we come back to the schools again with those glasses, and we fit those glasses on the children. And then this final step, which I think Dr. Bosch was referring to in his talk earlier today, is it's not just bringing this health intervention into school. That certainly addresses one of the steps. But the next step is making sure these kids wear their glasses consistently. And that literally takes a village. That takes everybody from the school crossing guard saying, hey, Johnny, why aren't you wearing your glasses today, to the teacher, to the nurse, to the parent, and really changing the culture within the school to be thinking about vision as part of everyday activities for children. Now, I'm going to touch briefly on one of the things that we're doing at Hopkins as part of this study is we're actually looking at the long-term academic impact of school-based eye care on how children perform in schools. We had done a pilot study of this, which is in your readings, called the Baltimore Reading and Eye Disease Study, and found a statistically significant impact of giving kids glasses who needed them on their reading scores. With Vision for Baltimore, we're doing this on a large scale. So we're not only looking at children's vision screening outcomes and eye exam outcomes, but also long-term outcomes on their academic testing parameters. What we have learned from the earlier Baltimore Reading and Eye Disease Study, and we've incorporated into Vision for Baltimore, is all of these nuances of how do you engage teachers in schools and parents to get kids to wear and keep their glasses. One of the most important things we've found is having a robust replacement program and also working with teachers to develop their own ideas of what's a good monitoring strategy for their classroom, or just even educating them about the fact that kids can have their glasses replaced whenever they are lost or broken. So I look forward to hopefully in the future coming back and giving you the update on what our results are from this study. Thanks so much.
Wonderful. Thank you so much, Megan. Next, Kimmy Sakashita.